Hello friends, I am Dr. Sulbha Arora, IVF specialist from Mumbai. As you are all aware, the entire world right now is at great threat due to the new COVID-19 coronavirus epidemic. We have seen how rapidly the virus has spread across borders to almost every corner of the world. Sadly, India is not immune to this as well, and currently we are in the midst of a 21-day lockdown in order to try and halt the progress of this epidemic in our country. You must have all heard our Prime Minister Shri Narendra Modi ji again and again emphasize the importance of staying indoors and not stepping out. All non essential services have been halted, including all elective medical procedures. So, now what does this mean for those of us who are planning or undergoing fertility treatments at present? Fertility treatments are not emergency treatments as well, they are non essential in the current scenario. So, in line with the recommendations of scientific societies in reproductive medicine the world over, what is advised is, as a precautionary measure for anyone planning or undergoing a fertility treatment, to not try and get pregnant at present. For those who have already started the treatment, it would be best to defer the pregnancy part by undergoing the embryo transfer at a later date. So what this means is, if you have not yet started your IUI or your IVF cycle, now is not a good time to start. If you were planning a frozen embryo transfer and you had already started your estrogen tablets, even in that case, it would be best to postpone the transfer, not undergo it right now. The postponing of the embryo transfer or deferring it to a later date is not going to reduce your chances of conceiving. If you are undergoing a self IVF cycle and your injections have already started, your stimulation has already started, then you have two options. Best, of course, would be to stop the injections, stop the stimulation, and restart it at a later time when the pandemic crisis has subsided. If you have already taken a number of injections for a large number of days, your follicles are ready and you are at the point where now you just have to take the trigger, then you can discuss with your fertility specialist. Perhaps you can take the trigger but freeze all the oocytes or the embryos, not undergo the embryo transfer right now. The logistics, the costs involved, these are things that you would need to discuss with your fertility specialist. It is disheartening, we do understand, when you have been desiring something for so long, to have suddenly a spanner thrown into the works and the cycles to be halted. But this one small step that we take right now is going to be a large stride in trying to control the pandemic. We need to keep in mind that the novel coronavirus is a new virus. The human beings have not been exposed to this so far, and as a result, we don't have any immunity to fight it. Because it is a new virus, we also do not have, as of now, effective vaccines or effective cures. Scientists are working on a war footing to try and develop these, and hopefully we should have a solution soon. How long will it be before we can resume all our routine work, our routine services, and you can continue with your plans of embryo transfer? We don't have an answer right now. But if each one of us does our bit by staying indoors to halt the epidemic, we can hope that this would be sooner rather than later. So, just like the rest of the world, this is the time to halt, to pause, to take this time to focus on yourself. Focus on your hobbies, be it reading, cooking, yoga, meditation, gardening. Take this time to de-stress. And once we have come out of this pandemic, and the time is safer, will be a better time to undergo the embryo transfer and try and get pregnant. So right now, you focus on yourself, you take good care of yourself, and let's hope that we can fight this together. Stay safe, take care.